The human skull is composed of 22 different bones, which can be grouped into two main sections, the cranium and the facial skeleton. The cranium houses and protects the brain, while the facial skeleton gives structure to the face and supports essential functions like eating, breathing, and sensory perception. These bones are connected by fibrous joints known as sutures. The cranium is formed by the following 8 bones. The frontal bone, located at the front and forms the forehead and part of the eye socket. The 2 parietal bones, which shape the sides and roof of the cranium. The occipital bone at the back of the skull. It features the foramen magnum, which is a large opening through which the spinal cord connects to the brainstem. The temporal bones, which are also paired, are located near the ears. They house structures essential for hearing and balance. The sphenoid bone is butterfly-shaped and spans the base of the cranium. It connects with nearly every other cranial bones and contains the sella turcica, a depression that houses the pituitary gland. The ethmoid bone, which is a lightweight, spongy bone located between the eyes, it contributes to the nasal cavity and the medial wall of the eye socket. The facial skeleton consists of 14 bones. It is made up of the following: the maxilla or upper jaw bone, which forms the floor of the eye socket, the sides of the nasal cavity, and the roof of the mouth. The mandible or lower jaw bone is the only movable bone in the skull. It helps with chewing, speaking, and facial expressions. The zygomatic bones, commonly known as the cheekbones, connects to the maxilla and the temporal bones. The nasal bones form the upper bridge of the nose. The lacrimal bones are the smallest facial bones. They are located in the medial wall of the eye socket. The vomer is a thin, flat bone which forms the lower part of the nasal septum, dividing the nasal cavity into 2. The inferior nasal conchae are 2 scroll-like bones which increase the surface area inside the nasal cavity. The palatine bones form the back part of the roof of the mouth and the floor of the nasal cavity. The skull contains several cavities that house vital structures, as well as openings called foramina, which allow nerves and blood vessels to pass through. The 2 orbital cavities, or eye sockets, house and protects the eyes. The nasal cavity warms, filters, and humidifies air before it enters the lungs. The oral cavity or mouth is essential for eating and speaking. The foramina of the skull are essential openings that allow the passage of nerves, blood vessels, and other critical structures from the skull. The optic canal, located in the sphenoid bone, transmits the optic nerve and the ophthalmic artery. The foramen rotundum, also located in the sphenoid bone, transmits the maxillary branch of the trigeminal nerve. The foramen ovale, also located in the sphenoid bone, allows the mandibular branch of the trigeminal nerve to pass through. The foramen spinosum in the sphenoid bone transmits the middle meningeal artery. The jugular foramen is located between the temporal and occipital bones. It transmits the internal jugular vein, the glossopharyngeal, the vagus, and the accessory nerves. The foramen lacerum is located between the junction of the sphenoid, temporal, and occipital bones. It transmits small vessels and nerves. The hypoglossal canal is located in the occipital bone. It transmits the hypoglossal nerve. The skull bones are connected by immovable joints called sutures. Key sutures include the coronal suture, which joins the frontal bone to the parietal bones, the sagittal suture, which runs along the midline connecting the 2 parietal bones, the lambdoid suture, which joins the occipital bone to the parietal bones, the squamous suture, located on each side of the skull, connecting the parietal bones to the temporal bones. From the protective cranium to the delicate facial skeleton, the skull is a remarkable structure that combines strength, function, and beauty.